Hi everyone, my name is Candice and I'm from Healthcare Administration. And there's research, it's very interesting, it's about telemedicine. And this is my partner and we are going to share our findouts.
Let's go.
The COVID-19 pandemic was a global outbreak as the coronavirus disease has persisted and evolved in Taiwan and around the world. There was an urgent need for policymakers to deal with the infection, especially for vulnerable groups. Facing the COVID-19 outbreak and related lockdown, from May 2021, National Health Insurance Administration expanded telemedicine services to all citizens. Therefore, more and more people started experiencing online treatment in Taiwan.
What is telemedicine?
Online treatment, also referred to as telemedicine, was a health-related service by means of information and communication technology in order to provide timely medical diagnosis, treatment, and monitoring of patients at any location.
What are the major advantages of online treatment?
The major advantages of online treatment were to deliver treatment for isolated populations, more convenient, cheaper, to spare the time, and to prevent infection.
What are some disadvantages of online treatment?
Some disadvantages of online treatment were inability to perform full physical examination to increase potential diagnostic errors, the digital divide, people with poor technological literacy, and increased security concerns. Despite the above limitations in general, patients consistently reported a high level of satisfaction with telemedicine-based care.
I have been diagnosed with COVID-19 and received medical assistance through telemedicine. My experience was that it's convenient, time-saving, and effective medical service.
Good, thanks for sharing. In order to systematically examine Taiwanese people's evaluation of telemedicine usage, my research team conducted a study in 2022. The title was Facilitators and Barriers to Online Treatment Usage for Taiwanese People with and Without Experience. In addition to exploring the reasons and concerns about online treatment usage between Taiwanese people with and without experience, by means of the extended theory of planned behavior, TPB model, the present study also examining principal predictors of online treatment behavior intention.
What is the TPB model?
The theory of planned behavior was proposed by Isaac Eisen as an extension of the theory of reasoned action according to the TPB model. Behavior intention was guided by three kinds of considerations. 1. The person's attitude toward the behavior. 2. The person's evaluation of how important significant others consider the behavior to be, subjective norms. And 3. The presence or lack of things that will make it easier or harder to perform the behavior, perceived behavior control. The theory of planned behavior assumed that individuals act rationally. Moreover, it was found to be well supported by empirical evidence. In other words, the TPB model continued to offer a useful framework for research in social and behavior sciences. The research framework of this study was shown in Figure 1.
The objectives of this study were:
1. Understand the proportion of observations in the sample that have actual experience of online treatment, and 2. Review participants' perceived benefits and barriers about the use of online treatment. 2. Examine the differential effects of personal background information on online treatment behavior intention. 3. Analyze the differences between experienced and inexperienced OT individuals in the background variables and the man-dependent variables. 4. Investigate the correlation between the main continuous variables to OT behavior intention. And 5. Identify the important predictors of OT behavior intention.
Methods. A pilot study with 426 valid participants was conducted to test the quality and efficiency of the self-developed online questionnaire through the 7-point Likert scale. The main study was surveyed online from October 26 to November 26 in 2022. The data were gathered using convenient sampling with a total of 1,506 valid participants, 88.1% remaining after conducting the reverse order attention check method. After conducting the attention check, the EFA, and the internal consistency test, the final self-developed online questionnaire on a 7-point Likert scale had good construct validity. Total variance explained from 57.28% to 73.13%, and reliability cornerbacks alpha from 0.87 to 0.91. In other words, the instrument was rigorous and robust. Descriptive statistic, exploratory factor analysis (EFA), reliability analysis, contingency table analysis, ANOVA, correlation analysis, and multiple stepwise regression were utilized for data analysis.
Results: 90% of the participants knew of online treatment service. Moreover, they displayed a positive intention to use online treatment. The majority of people could find someone to handle online treatment issues, and about 55% of participants had online treatment experience. And about half of participants consider online treatment was as effective as or better than in-person treatment. The three most facilitators for online treatment usage were: 1. Be unable to attend all doctor visits. 2. Follow the anti-coronavirus measures. And 3. Prevent infections. The three most concerns for online treatment usage were: 1. Increase the risk of diagnostic errors. 2. Be difficult to discuss conditions on camera. And 3. Have poor picture or sound quality. Participants who were female, had higher education, had full-time job, and were married, and could visit doctors independently, showed significantly higher intention to engage in online treatment, respectively. In addition, participants who knew of online treatment service, had OT experience, used medical apps, could find someone to handle OT issues, had positive OT service evaluation, reported significantly higher levels of intention to adopt OT, respectively.
Compared to people without online treatment experience, there was a significant amount of people with OT experience chose have poor picture or sound quality and having unstable power internet connection as their main concern. On the other hand, a greater proportion of people without OT experience chose increase the risk of diagnostic errors, don't know how to perform the software system, and lack the hardware equipment at home as their main concern to use OT. There was a moderate correlation between attitude, subjective norm, PBC IT skills, OT training needs, OT anxiety, and OT behavioral intention, respectively. More specifically, OT anxiety was negatively correlated with OT behavioral intention. The best predictors to influence online treatment intention were subjective norm, OT training needs, PBC IT scale, attitude, OT anxiety, OT experience, and female. These predictors accounted for 63% of the total variance.
Conclusion: more than half of respondents had actual online treatment experience in this study, indicated that the COVID-19 pandemic and mobility restrictions put a spotlight on online treatment as an alternative method to provide medical services and to reduce the risk of infection in Taiwan. Even though people display a positive intention to use online treatment, and about half consider online treatment was as effective as or better than in-person treatment, the greatest concern for using online treatment was the risk of being misdiagnosed. The theory of planned behavior was an effective model for predicting people's intention to use online treatment. Besides, OT training needs, OT anxiety, and OT experience has significant impacts on online treatment usage intention. People with online treatment experience not only reveal different reasons and concerns about the use of online treatment than those inexperienced, but also gave a positive evaluation for the quality of online treatment. The results supported the high quality of Taiwan's medical care and the potential for the expansion of online treatment in the future.
The significance of the study. This study uses sufficient sample to compare the differences between those with and without online treatment experience. The results could be used as a more detailed reference for the government to establish epidemic prevention policies and strategies. The self-developed questionnaire had rigorous construct validity and reliability. It could be used as a valuable reference for subsequent related studies. Limitation. This study was based on the respondents' recall of online treatment usage. the possibility of memory distortion might not be ruled out.
Thanks for watching.